Adolescence is a time of significant change and growth, where individuals navigate the transition from childhood to adulthood. During this period, young people experience a wide range of emotional, psychological, and social changes that can significantly impact their mental health. These years are marked by the development of personal identity, an increased sense of independence, and a greater awareness of social relationships. However, the adolescent period can also bring about mental health challenges as teenagers struggle to manage the complex pressures they face. From academic stress to social pressures to hormonal changes, adolescents can experience mental health issues that may affect their emotional well-being and their ability to function in day-to-day life. Understanding the various factors that contribute to adolescent mental health challenges is crucial for providing the support and interventions that young people need. One of the most common mental health issues faced by adolescents is anxiety. Adolescents may experience anxiety in relation to school, relationships, or future plans. For example, they may feel overwhelmed by academic pressures or experience social anxiety about fitting in with peers. Anxiety disorders such as generalized anxiety disorder, social anxiety disorder, and panic disorder can all develop during adolescence. These disorders are characterized by excessive worry or fear that can interfere with a young person's ability to concentrate, interact with others, and engage in activities they once enjoyed. Adolescents may also experience physical symptoms such as rapid heart rate, shortness of breath, or gastrointestinal distress when they encounter situations that trigger anxiety. It is important to recognize the signs of anxiety in adolescents and provide them with the tools to manage their fears and stressors. Cognitive behavioral therapy and mindfulness techniques are often effective in helping adolescents cope with anxiety and develop healthier responses to stress. Depression is another significant mental health challenge faced by adolescents. Adolescence is a time of emotional intensity, and many teenagers experience periods of sadness or mood fluctuations. However, when these feelings become persistent, overwhelming, or interfere with a teenager's ability to function, it may be a sign of depression. Symptoms of depression in adolescence may include persistent feelings of hopelessness, irritability, changes in appetite or sleep patterns, difficulty concentrating, and withdrawal from friends and activities. Adolescents with depression may also engage in risky behaviors such as substance use or self-harm as a way to cope with their emotional pain. It is important for caregivers, teachers, and mental health professionals to be vigilant about the signs of depression and provide the necessary support to help adolescents manage their emotions. Therapy, particularly cognitive behavioral therapy, as well as medication in some cases, can help adolescents recover from depression and improve their quality of life. Another mental health concern that is prevalent among adolescents is eating disorders. Eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder, can develop during adolescence due to a combination of biological, psychological, and social factors. Adolescents are particularly vulnerable to societal pressures related to body image and appearance. The desire to fit in or meet certain beauty standards can lead to unhealthy behaviors around food, including restrictive eating, overeating, or purging. Eating disorders can have serious physical and psychological consequences, including malnutrition, organ damage, and long-term mental health issues such as anxiety or depression. It is essential for adolescents with eating disorders to receive early intervention and comprehensive treatment, including nutritional counseling, individual therapy, and family support. Supportive environments that promote healthy body image and self-esteem can help reduce the prevalence of eating disorders among adolescents. Self-esteem and body image concerns also play a significant role in adolescent mental health. Adolescents are particularly sensitive to the way they are perceived by others, and issues related to appearance, weight, or social acceptance can contribute to low self-esteem and mental health struggles. For example, an adolescent who feels they do not meet societal expectations of beauty or success may struggle with feelings of inadequacy or worthlessness. These feelings can be exacerbated by peer pressure, bullying, or unrealistic portrayals of beauty in the media. Adolescents with low self-esteem may be at higher risk for developing mental health conditions such as depression, anxiety, and eating disorders. It is essential to create supportive environments where adolescents feel valued for who they are, rather than how they look or how they compare to others. Encouraging open communication, fostering self-acceptance, and promoting healthy relationships can help build self-esteem and improve overall mental well-being in adolescence. Substance use is another significant mental health challenge during adolescence. Experimentation with drugs and alcohol is common during the teenage years, but for some adolescents, substance use can escalate into a substance use disorder. Adolescents may turn to drugs or alcohol as a way to cope with stress, peer pressure, or emotional pain. Substance use can impair judgment, interfere with academic performance, and increase the risk of engaging in risky behaviors such as unprotected sex or dangerous driving. Additionally, substance use can lead to long-term physical and psychological health problems, including addiction, liver disease, and depression. Preventing substance use and addressing early signs of misuse is essential to promoting adolescent mental health. Early interventions that focus on building coping skills, addressing underlying emotional or behavioral issues, and providing education about the risks of substance use can help reduce the incidence of substance abuse in adolescence. Adolescence is also a time when many young people begin to experience challenges related to their sexual orientation or gender identity. Adolescents who identify as LGBTQ+ may face unique mental health challenges, including discrimination, bullying, and internal conflict related to their identity. These challenges can lead to feelings of isolation, anxiety, and depression. For example, an adolescent who is struggling with their sexual orientation may experience distress about coming out to their family or friends, or may feel rejected by their peers. Adolescents who face rejection or lack of support for their gender identity or sexual orientation may be at higher risk for mental health issues such as depression, anxiety, and self-harm. Creating inclusive, accepting environments and providing access to supportive resources such as LGBTQ+ support groups and mental health counseling can help adolescents navigate these challenges and improve their mental health outcomes. Another important issue affecting adolescent mental health is the increasing impact of social media. Adolescents today are growing up in a digital age where social media plays a prominent role in their social interactions and self-perception. While social media can offer opportunities for connection and self-expression, it also has the potential to negatively affect adolescent mental health. Social media platforms often promote idealized portrayals of life, leading to comparisons, feelings of inadequacy, and the pressure to conform to unrealistic standards. Adolescents may experience anxiety or depression as a result of cyberbullying, social comparison, or the fear of missing out, FOMO. Furthermore, excessive use of social media can interfere with face-to-face interactions and contribute to feelings of isolation. Educating adolescents about the potential impact of social media on their mental health and encouraging balanced usage can help mitigate these negative effects. Adolescents who have experienced trauma or adverse childhood experiences are at greater risk for developing mental health challenges. Traumatic events such as abuse, neglect, or the loss of a parent can have lasting effects on a teenager's emotional well-being. Adolescents who have experienced trauma may struggle with feelings of anger, shame, or fear, and may have difficulty trusting others. These experiences can lead to mental health issues such as post-traumatic stress disorder, depression, and anxiety. Providing trauma-informed care and creating safe, supportive spaces for adolescents to process their experiences is crucial in helping them heal and move forward. Therapy, particularly trauma-informed cognitive behavioral therapy, can be effective in helping adolescents address the impact of trauma and develop healthier coping mechanisms. Finally, adolescent mental health challenges are often interconnected with family dynamics. The family is a key source of support and stability for teenagers, but family conflict or dysfunction can contribute to mental health issues. Adolescents who experience familial stress, such as parental divorce, substance abuse in the household, or emotional neglect, may struggle with feelings of insecurity and emotional instability. Family therapy and support for parents can help improve communication, resolve conflicts, and foster a healthier family environment. Addressing family dynamics is an important part of supporting adolescent mental health and promoting positive emotional development.